Say that Obamacare didn't slow the growth of premiums in any meaningful way.
Thank you. I now recognize the gentleman from Texas, Mr. Gill, for 5 minutes.
Thank you, Mr. Chairman. Thank you for for holding this hearing, and thank you for to the witnesses for taking the time to be here. We certainly really appreciate it. I appreciate my colleague on the other side of the aisle and their sincerity and their desire to fix our healthcare system and make it better. I would suggest that Social Security and our healthcare system are not comparable or perhaps even analogous. Our healthcare system is $5 trillion. It's about 18% of our GDP. And Social Security does not have the same bloated cost structure that is inherent in a single-payer healthcare system, which our colleagues on the other side of the aisle have been ultimately proposing. And I think we need to think a little bit more deeply about ways that we can bring those costs down rather than bringing in, I think, incomparable and unanalogous other government programs. But with that said, I do think that there's a lot of bipartisanship in healthcare, and I think that there's a lot of things that we would agree on. Ms. Tripoli, thank you for being here, and thank you for your testimony. I believe in your testimony you urge policymakers to get to the root causes of high and irrational prices in our healthcare system. Is that correct?
Yes.
And you would agree that healthcare consolidation is one of the main drivers of high prices for patients?
Yes.
I certainly agree. And you also mentioned price disclosure, that hospitals should disclose the rates that they charge openly in dollars and cents, I believe were your words. Is that right?
Absolutely, yes. Price transparency.
I certainly agree. You also mentioned site neutrality, that we ought to prohibit health systems from charging Medicare more for the same procedure if it's done in a hospital versus a doctor's office. Is that right?
Yes.
Well, those are I think are all things that we can agree on, which is really nice to hear. So I appreciate that. Mr. Jacobs, I want to ask you about Obamacare. Obamacare was sold to the American people as a program that would drive down premiums. I think the number that was thrown out by President Obama at the time was $2,500. Has that promise come to fruition?
No, it has not, Congressman. And premiums on individual health insurance policies on the marketplaces and the exchanges more than doubled in the law's first 4 years, and that's primarily because of the regulatory mandates that the law imposed. And premiums have continued to increase substantially, and they continue to increase substantially more so on the exchanges than for employer-sponsored coverage.
So you would say that Obamacare didn't slow the growth of premiums in any meaningful way?
I think, if anything, quite the contrary. I mean, Senator Welch, I believe, last month admitted on the Senate floor that the law failed to reduce costs.
Today we're diving into a fiery, eye-opening congressional exchange that exposes the truth behind rising healthcare costs, consolidation, price transparency, and whether Obamacare delivered on its promises. This clip is packed with bipartisan moments, candid testimony, and some serious myth-busting, so let's break it all down, clearly and creatively. A hearing begins. The chairman recognizes the gentleman from Texas, Representative Gill, for 5 minutes. Respectful, calm, and collected, he thanks the chairman, the witnesses, and even his colleagues on the other side of the aisle for their sincerity in trying to fix America's complicated, expensive healthcare system. But right out of the gate, he draws a sharp line.
Healthcare and Social Security? Not comparable, not even close.
Healthcare, $5 trillion, 18% of our GDP, and loaded with bloated costs that a single-payer model wouldn't magically fix. He wants solutions, real ones, not comparisons that don't match the scale or complexity of what Americans face every day. Now here's where things get interesting. He turns to Ms. Tripoli, a witness pushing policymakers to attack the root causes of irrational healthcare prices.
Price disclosure? Site neutrality?
Yes. Transparency? Absolutely yes.
They agree. Hospital consolidation drives prices up. Hospitals should disclose real prices in real dollars. Medicare shouldn't be charged more just because a procedure happens inside a hospital instead of a doctor's office. A rare moment of bipartisan harmony and a refreshing one. Then Rep. Gill pivots, and the tone shifts. He turns to Mr. Jacobs and asks the question millions of Americans have asked for over a decade. Did Obamacare actually lower premiums like we were promised? President Obama once said the average family would save $2,500. So, did it happen?
No, Jacobs says simply. And then he drops the hammer. Premiums doubled in the first 4 years. Regulatory mandates drove prices up. Premiums on the exchanges rose faster than those in employer-sponsored plans.
Not only did Obamacare fail to slow rising costs, it may have accelerated them.
And that's what I was getting to. Did Obamacare address or fix any issues related to price transparency?
Ultimately, there have been regulatory efforts. Some of the Trump administration efforts were actually linked to regulatory requirements in the law, but I think we can and should do more. And I think we've also seen that hospitals aren't necessarily complying with that law either willingly or easily.
Did Obamacare address or fix issues related to pricing disclosure?
I think we need to do more is what I would say.
Got it. And it's your testimony as well, if I heard you correctly, that Obamacare actually exacerbated pricing issues related to healthcare consolidation.
That's correct, and we've seen that in many areas. For instance, the Congressional Budget Office recently released a report on the 340B program and how the 340B program encourages increasing federal spending and consolidation. Now, Obamacare did not create the program, the 340B program, but it certainly dramatically expanded it and is one of the reasons why it's continues to grow and continues to accelerate health costs.
Got it. And there's with the remaining 30 seconds, as you know, there's a lot of debate right now about potentially extending COVID-era enhanced premium tax credits. In your opinion, would that lower overall healthcare costs, or would it raise overall healthcare costs?
The subsidy regime is inherently inflationary because once an individual hits their income in terms of how it's structured in the law, the percentage of income, every marginal dollar of a premium increase gets paid by the federal government. So insurers have no incentive to control costs because whether the premium goes up by 1% or 100%, the feds subsidize that. And so it's an inherently inflationary structure. We've seen the concerns about fraud. I think those reasons, coupled with the fact that enrollments have held steady thus far in open enrollment, all suggest that we should allow the enhanced subsidies to expire.
Got it. Thank you.
Obamacare failed to slow rising costs, it may have accelerated them. Hospital mergers, insurers swallowing up pharmacy benefit managers, consolidation everywhere.
And when Representative Gill asks whether Obamacare addressed price transparency, Jacobs answers, not really. Some efforts happened later, but compliance is spotty and enforcement is weak. Jacobs continues, Obamacare didn't create the 340B program, but it supersized it. And according to the Congressional Budget Office, that expansion has fueled both higher federal spending and more consolidation. More consolidation, fewer competitors, higher costs. It's a pattern that keeps repeating itself.
With just seconds left, Representative Gill goes for the final big question. Should Congress extend the COVID-era enhanced premium tax credits?
Jacobs' answer? Those subsidies are inherently inflationary. Because once someone hits their income threshold, the federal government covers every extra dollar of a premium increase. Every single dollar. Meaning insurers have no incentive to control costs. Why would they? No matter how high prices climb, taxpayers foot the bill. Jacobs adds, fraud concerns exist. Enrollment numbers have stayed stable. It might be time to let the enhanced subsidies expire.
This exchange shines a spotlight on some of the biggest pressures weighing down America's healthcare system: consolidation, lack of transparency, inflationary subsidies, unmet promises, but it also shows something rare: areas where both sides of the aisle actually agree. And when that happens, real reform becomes possible. If you found this breakdown helpful, don't forget to like, subscribe, and tell me in the comments, what part of this hearing surprised you the most? See you in the next one.